When you're in retirement, there is the risk of a bill that none of us know whether it's coming. And we've all seen it with either our grandparents, our aunts, our uncles, friends, parents. Um, and that bill is long term care, right? We're all going to get old one day. We don't know how we're going to go. We don't know if it's going to be a slow process, a long process, but whatever it is, we got to make sure that we have a plan. And so tonight, what we're going to talk about is how we navigate long-term care and retirement as federal employees, and how we navigate FEHB and Medicare. Right, all those this topic is super important. We talk about it in our retirement readiness assessment is one of the 5 things that we make sure we address when we're meeting with clients when we go through their financial plan and retirement. And so today is one of my least favorite topics just because it's so much complexity, it's so much change, it's so much things that we can't control. And so what I would do today is I'll do my best to take all my years of experience in helping clients go from being 50 years old to 70 years old or 60 years old to 80 years old and their spouses aging and things like that. And from what I've seen, and help you create a better plan for you and your spouse, or whoever's in your family. We'll do that today. And so, one of the things that oftentimes gets misconstrued is people think that FEHB, which is your federal employee health benefits, covers long term care. Most people say, "Well, I've had Blue Cross Blue Shield, or whatever the platinum plan is, and you pay a whole lot from it for it." But the reality of it is, your FEHB is very limited. Your FEHB does not cover custodial. They call it, and the term is custodial long term care, right? And that what that means is your health insurance will not cover a nurse coming through your home and helping you with everyday things like bathing, dressing, eating, things like that, right? It will cover you for a lot of things, but it will not cover you with those things. Another misconception is that Medicare will do that, right? Medicare Part A will do it up to 100 days, and then you're on your own. But at day 21, they start charging you $217 a day as of this recording. So just imagine you've already gone through the hospital, you've been in the hospice space. Day 21, you have to start now paying $217 a day, which is a significant amount of money. And that only lasts up to age 100. I mean, to day 100. And so the only thing that you can do in this case is you must make sure you have some type of plan financially to bridge the remaining of that. I wouldn't even want to call it a gap, but the remaining of that time. Now you could do Medicaid, but again, or some type of nurse home facilities. But in that case, you have to give up everything you own in order to do that. And so the government knows that, everybody knows that for the most part. I mean, we live in America, we see it all the time, right? And we see people struggling with healthcare costs and things like that. That's why it's such a big topic. You don't want to, and you want to be treated well. You don't want to go to a facility that's not up to par. And so one of the things I talk about with a lot of our federal employees is this: you have an option, right? You can get the federal long-term care plan, when it's available, because it goes in and out. And so, or you can get your own private long-term care policy. That's an option too. The problem with those policies is what we've experienced is the costs can continue to go up for those, and you don't know when that next cost increase is going to be. The federal long-term care plan has been on it like these 7-year contracts, and every 7 years the contracts renew. And the problem with it is you could start paying one thing, and then 7 years later your premium is increasing. And I've experienced that with a bunch of clients. And the thing about it is you have no control over it. And so when you need the care, you need the care. You don't want to be thinking about what the next contract negotiation will be with the government. And that's how John Hancock and the federal government fell out, because John Hancock needed to increase the prices. The government wanted to keep the prices suppressed. But with the cost of healthcare, it became an issue. And so consistently, this has been an issue with the federal long-term care plan. Now, if you got it, that's great. I'm not saying cancel anything like that. I'm just saying you have to be able to manage the potential cost increase that will occur. And historically, there have been cost increase. So One of the things that we talk a lot about when we're meeting with clients is this: as federal employees, you all have it good. And the reason why I say you all have it good is this: because you have your pension, because you have your social security, you can afford to, what we like to say, self-fund long-term care in most cases. I'm not saying do this blindly. I'm not saying that. Obviously, you want to meet with somebody, meet with an advisor, somebody to walk through your plan yourself. And if you want to meet with us, we can do it. But one of the things that I've seen a lot of federal employees do is self-fund long-term care. What I mean by that is this, and I'll show an example of it in a second because I think it'll drive it home, and the visual of it will make a lot of sense. Is because you're not using your TSP, you can afford to allow your TSP to grow in case you run into a long-term care scenario. Now, there's all types of calculators out there that can help you understand how much your long-term care can be in your specific state based on average costs, and you can calculate that based on inflation as well. So that way you can know, okay, well, if I run into a situation, I need to have X amount of dollars set aside in case I have a long-term care scenario, right? And of course, we do that for clients, and that's one of the first things we look at. And I will say this: in majority of cases, for clients that have a decent amount of money in their TSP, of course, it depends on their bills and things like that, you can self-fund long-term care. And I'm gonna show you an example of a lady that had 515,000 in her TSP. We showed her a way to self-fund her long-term care, and we put that in motion. One thing you want to know about long-term care, though, is how they work functionally. When you have a long-term care policy on each, and we offer long-term care policies, just so we're clear. When you have a long-term care policy, there's a dollar amount that oftentimes is the top line spend. And so even within a long-term care policy, there's an amount of money that if you go over, that plan will expire. And so you just do the same thing with your TSP. You just make sure you have X amount of dollars set aside in case something happens to you. Super important because, again, if you haven't gotten it yet, you're getting close to retirement. One of the things I hear all the time is, "Ms. Smith, I want to buy long-term care, but it costs so much." And I get it. It's not one of those things you buy in your 40s, because it's something you're not going to need until almost 40 years later. And so if you waited, that's fine. Get it. One of the options is to self fund your long term care. So, what I want to do is I want to show you what that looks like. I'm going to share my screen. And this is a real client. We changed the name, obviously, but this is a real scenario. So, if you ever meet with us, we take you through what we call this is our retirement analyzer software. And so we meet with you, we put all your information in this software. We update this software as we progress through your retirement. Of course, we left the numbers, we deleted all the things that didn't matter. But anyway, so here's her pension, her first supplement pension. Her first supplement ends at 62 and all that. So we got that there. And then we have her TSP. Now, when we met with her TSP was invested pretty conservatively. She had it She had it all in the G fund, or large majority of it was in the G fund, so she wasn't getting a large return. And this is the reason why when you retire, we often talk about making sure you have your TSP invested in a way that you're outpacing inflation. Why that's important is because as you get older, especially when it comes to long-term care can get quite expensive, and long-term care usually outpace the cost of medical care usually outpaces inflation by itself. The baseline inflation number, which is, let me see, the baseline inflation number over the last 100 years has been 3.27. So the TSP, I mean the G fund, over the last 10 years has been below that number. Okay. And so what you want to do is you want to make sure that, and so just imagine the G fund is below 3.27 over the last 10 years. And then the cost of healthcare is above the normal inflation average. So you're getting double screwed really, because your money's is slow, inflation is higher, but then you got your medical costs are higher than inflation, right? And so you have to think about that type of stuff. And so what we do is we look at how much a person has, how long it's going to last them. Now in her situation, she did not need, with her expenses at 4,400, and as you see here, her fixed income covered her covered her bills, right? No problem, no problem at all. Once Social Security kicked in, everything, she had a her income is 6,300. Her expenses 52, right? We can ignore this gap. This is when we were cleaning it up a little bit for to raise personal data. Don't worry about this negative right here. That's not. But this is her real number here, right? And so as you can see, her expenses are higher than her income is higher than her expenses. No problem as far as her fixed pension and her fixed pension and her social security. So her fixed income is higher than her expenses, and her TSP can sit over here and grow. Now, what we did was when we first met with her, it was like, okay, if you have your money invested like you have it, let's go to our long-term care tab. Okay. And so we go to our long-term care tab. This woman is is retiring in Maryland. And so we look at so our system automatically inputs Maryland's rates at the time. Okay. Now we also put the cost increase of inflation in there and all that, right? And so now what we do is we project down to the year 80 when she could possibly start utilizing the long-term care. And as you can see, the average cost of long-term care in Maryland by year 5, she's run out of money. God forbid any other emergency happens before then, she's in trouble. Okay. And so for us, when we see this red line, especially so soon after the 4 year, because we usually calculate long-term care for 4 years. Because if you're in long-term care for longer than 4 years, I mean that's pretty much the longest you'll be in that type of care, but in most cases. Um, but you see here, so that means if everything goes perfect, she'll make it just past that 4 year. And so what we do is what we talk about all the time when we talk about your financial house and things like that. And so for her, that was one of her biggest issues. And so what we always talk about is making sure you have different type of buckets. You want to have a growth bucket and a protected bucket. And a lot of times we keep that in mind because we want to make sure that you have money that's consistently growing out past inflation, meaning like your TSPC fund, right? Over the last 10 years, I believe is at like 15%. Now, the risk to it is if you're taking income and the market's dipping in the years you take income, that could be problematic. But if you put it for long-term growth, oftentimes you can, I mean not oftentimes, but as it grows over time, that account continues to increase as most of you all have seen as you've been working. If that count increases over time, over a longer period of time, you have a lot more money there to utilize when it comes time for retirement. And so when we go to her case, as you see now, we've eliminated the red now. And again, this is worst case scenario. Now, if something would have happened to her, she still has money set aside. Little tweaks make a big difference. Right now, this is without her having a long-term care policy. This is in case something happened. If she, I mean, I hate to say it, she could die in her sleep or suddenly or whatever, and not need any of this, and her family just gets all the money that she has there. Okay. But what I'm saying, why am I saying this? As federal employees, because you all have a pension and social security, you can allow your spendable asset, in this case your TSP, continue to grow throughout retirement. Unlike someone in the private industry who all they have is social security and their pension. Long-term care becomes extremely important to them because if you take away, like for example, if we were to delete, and this is most people's reality, if we were just to delete this and delete this, most people are living like this. They got their social security and they got their 401k from their job. If we were to do that, you see the difference here? Well, they wouldn't even have been able to retire early like this. They would have retired down here. And then now they retired at 65 with a higher social security. They got their pen. Well, they got their pension, but the money just doesn't last. And so in these situations, you need you need your long-term care because long-term care prevents If something happens here, it prevents that money from running out, right? And so, because they need the money for they need the money for income, they needed to stretch longer, right? The whole retirement strategy changes when you delete a pension out of somebody's retirement account. This is why, as federal employees, you guys have it way different. And so, I'll stop sharing my screen now. But as federal employees, it's super important that you put money towards your TSP, because the more money you put towards your TSP, the more options you have in retirement. And this is why I always talk about there's retirement advice for federal employees and there's retirement advice for everybody else. For everybody else, they got to be way, 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 way more conservative than y'all have to be, because they need that 401k money to last their entire life. Very different. You all have a lot more flexibility. You all can build a lot more wealth. You all can do a lot more, lot of different things. And so that's the long term care conversation. Long term care is a big topic when it comes when when you see it from financial advisors, the news, and things like that. The reason why it's a big topic is because for non federal employees, that 401k they can have. I mean, they could have 100,000, 800,000, million in their 401k, but as soon as they retire, that 401k has a slow leak every month, because that's paying them every single month. And that same thing that's paying them every single month, long term care, I mean, medical emergency hit, boom, they got to go to that same bucket and draw down on that same bucket that's paying them income. And so long term care policy stops that a bit, because, well, not stops the leak, but it stops the double leak. And so that's why it's such a popular product. But as federal employees, it's very different. Now, again, I'm speaking general advice. I don't know everybody's situation. Would love to meet with you, talk to you more about it. But I'm just speaking in general when it comes to federal employees and some of the questions that come up for a lot of federal employees. So that's the long term care thing. Let me talk about FEHB a little bit here. So, when it comes to your federal employee health benefits, as you know, or maybe you don't know, FEHB is one of the best health insurance programs out there, especially for retirees. The reason being is the government still pays 70% of the premium. Now, you might be thinking, it still feels expensive. It does. I mean, healthcare is just expensive because of what it is, but it's still cheaper than what it will be if you got it on your own, right? Still, they still pay 70% of the premium, which is great. Now you got all different type of plans, all that is dependent upon your income, what your health is, all those different things factor into that. But people always ask, is it a decent plan? I think it is, based on what the comparison is uh, for most companies, right? Most companies are paying 25 to 50%. Government pays 70, which is pretty good. Now, some of the simple questions that you all may already know. If you have a spouse, they have to be on there for 5 years before you retire, or you have to be on there 5 years before you retire. Those type of things. Oh, and then we also talk about the survivor benefit. If you don't do survivor benefit, then your spouse will have to go get their own coverage. They won't be able to be covered by FEHB when you pass on. Okay. But that's another thing when it comes to life insurance and TSP. If you're leaving them your TSP and you're leaving them a big balance, it won't matter as much. If you're leaving them life insurance, they might have a higher health insurance cost, but you're leaving them 400,000 tax free. So you have to balance what's most important to you on that. But those are some of the things that you have to think about when it comes to healthcare. Now, one of the other questions we get a lot about is, if I have my FEHB, do I need Medicare Part B? Now, this is truly a personal decision. I know people that just they take the most expensive FEHB and they just go with it, and they say, I don't need to pay that extra money every month for Medicare Part B, and I don't feel like dealing with all the the cost increases and managing all that stuff. Again, I'm not going to tell you which is better and which is worse. Some people like it that way. Some people don't. Some people prefer the Part B because Medicare pays first, FEHB pays second. You get to waive all your copays. Part B waives all your copays. It's a much bigger network. Um, those are some of the things some of the reasons why people do Part B. It's just pure peace of mind, and again, that's based on your income. Some people might not want to pay it, but the reason why people do pay for it is the peace of mind because you get everything covered outside of long term care stuff, though. But you mean you get the top of the line coverage, the peace of mind coverage that you don't often get with most FEHB plans. Some you do, but there's still limited networks and things like that. With Medicare, you don't have that issue. One of the other issue, one of the questions that we get a lot is, what if I'm still working and I turn 65? Do I have to take Medicare? No, you do not have to take it at that point. But once you retire, you do have to enroll in it. If you don't, then you get a 10% penalty after the 21st month. And then after that, after the next year, it's another is a 20% penalty. And so you have to enroll once you retire, unless you will be penalized. Um, Another question that we get around this is if I'm making 180,000 when I retire, 2 years before I retire, and they have the 2 year look back, do I have to pay at that income? No. I mean, yes, yes. If you don't file a form, there's a form that you have to file, and I can't think of the name of the form. I think we talked about it last week. It's just slipping my mind. But that form, when you send it in, it's just list loss of job or retirement as a life changing event, and it will reduce it down to your current premium what your current premium should be based on your reduced income. You could do that if you get married, spouse passes, or something that any major event, any life changing event will allow you to reduce that. But you have to submit that form. If you do not submit that form, they have no way of knowing. You're just going to get charged based on the 2 year look back. So you have to make sure you do that. Uh, Again, a lot of this stuff we cover in our retirement. I mean, our TSP finish line process when we will build out the retirement analyzer for you. Super important topic. I hate the topic though because things change so consistently. Because things change so consistently, you want to make sure you're on top of things. And as a federal employee, the thing that you could do the best, that's a cure-all for most of your retirement issues, is make sure you're putting as much into your TSP as possible if you're still working. If you're retired, making sure you diversified into growth and protected buckets. Because if you're all sitting in the G fund in your retirement, that's a problem because now you're getting crushed by inflation. You might not look like you're losing money, but you're getting crushed by inflation, like I showed you in her situation. Or if you're all in the market, 2 years of negative market declines, and you're in trouble, and then you're now chasing the market. The best approach I've seen is having a growth bucket and a protected bucket. Now, what that is for you, I don't know. Um, and then we also talk about tax credits and stuff. But when it comes to this, having a growth bucket and a protected bucket is really, really important for healthcare needs because that's exactly where you would go if you have that protected bucket. You can go right there for these healthcare costs. And so that's where I'll stop today on this. We got 7 minutes left. I thought I would take less time than that on this topic, but we don't talk much about it. And so now I would love to take some questions if we have any. Is there any Fed LTC options even available again since they suspended it some time ago? I think there's one that's supposed to be opening up in December. But those things are, I think it's closed right now. I'm pretty sure it's closed right now, and it's supposed to be opening up in December. But Christopher, those contracts expire on average every 7 years. It's just unreliable, man. From historically, it's been just an unreliable process. If you can get in, you can get in. The issue is once you get in, what's the cost going to be next time? And so you just want to make sure, like I said, you want to make sure you're putting as much towards your TSP as possible because that is the cure all. If you have as much in your TSP as possible, it'll benefit you a lot in the long run. Any other questions? No, 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 Lachelle, no, Lachella. As long as you're working, that's you have a qualified plan, and so as long as you have a qualified plan from an employer, you're not going to get penalized. But as soon as you retire, you have to register for Medicare if you want to get it. Any other questions? Yeah, so there's hybrid policies, that you could do. There are hybrid policies that you could use. Again, we could talk about them offline. It's very specific to your situation. Very specific to your situation. And there's a couple of different types. They're not bad, but I would just say, Chris, because I know you're still working, I would prioritize putting as much towards your TSP as possible. But if you want to talk about some, we can offline. Any anything else? I just want you to know. Oh man, congratulations, John. Congratulations, John. I will have Raphael, that's your advisor, reach out to you, man. Congratulations, man. I know your wife is happy to finally have you home. Do you have to enroll in what, John? I mean, Christopher, enroll in Medicare or long term care? Oh, well, I can answer. In Medicare, you have to enroll. You have to enroll right away. I mean, but they give you some time, but you want to enroll right away because if you go beyond that time, then you get penalized. And it's within that first year, and then they give you a little extra time after that. Then there's a 10% penalty, then a 20% penalty the next year. Yvette, I don't know the form by name, but I had a team email it to you. You can, you can. Like I said, Yvette, I have the team email you everything you need. Any other questions? And if you all want to sit down and talk about this stuff, we can. It's best to build out a plan first before you make. Well, the Medicare decision is different, but when it comes to long term care and things like that, you want to just make sure you have a plan, because long term care can get quite expensive. And again, it's something that you might use, you might not, but you want to make sure that you have a plan in place to know to know what you should do there. Any other questions? Okay, if you already have FEHB and I'm about to turn 65, do I even need Medicare Part B? Again, that's a personal decision. I've seen it go both ways. I've seen people say, you know what, I got FEHB, I don't need Medicare, and I've seen people do both. Now, I've never had somebody come back to me and say they wish they had Medicare. I will say that, but I don't know everybody's story. You know, I don't know everybody's story in the details, right? So that's when I'm just not comfortable giving advice from the front of the room on. Can you put that question up again? Yeah, Shanita, again, if I sat down with you one on one, I can tell you based on there's certain indicators like how much you have in your TSP, how much income you have versus your expenses, what you want, what your legacy plan is, what's your tax plan. And from those things, we could talk through it, whether it's worth it or not. And that's the best I could say, Shanita, based on front because again, it's up to you whether you do Medicare or not. It's a personal decision. I say this from again speaking to people that take Medicare, the premiums aren't a big deal to them based on how much income they have for the peace of mind that it gives you, right? If you have the income and the 200 and some change dollars isn't a big deal to you for that peace of mind, why not? That's how most people look at it. And so we could sit down and look at your situation and decide that way. But from the front of the room, it's just impossible to say whether it's a good thing or a bad thing. Yes, just the team will send you a link. We'll set up a time and go through it and build out a retirement plan for you so you can see. Yep. Is that it? Are we at the 8 o'clock mark? Okay, we're at the 8 o'clock mark, y'all. Appreciate y'all. If you have any questions, always email us. Y'all get follow-up emails. People email us all the time. Just reply to the email with a question.
book a time with one of our advisors. We'll walk you through all this stuff in detail. We'll take you through that retirement analyzer system to make sure you understand it, understand what your personal situation is, and that's the really the best way to do it. Right? You work long, you work hard. When you retire, you want to retire with a plan in place so that you have that peace of mind when you retire. So, all right, y'all. We will see you all next week. Talk to y'all later. Bye bye.